Morning.
Good morning.
Are you?
Oh, you're muted.
You're muted.
Okay. Sorry.
Oh, no problem. Yeah,
Okay. Can you hear me now?
I can hear
Yeah.
you now, coming in loud and
All
clear.
right.
I
Good
guess.
morning.
Good morning.
Everybody.
I guess we'll just start with the COVID census count because I know that's what you're going to ask first.
Yeah.
Yeah.
Of course. Yes. As of this morning, we have 38 COVID positive individuals in the house. That includes 4 of them who are in the emergency room. And then we also have a POI in the emergency room waiting to get the test results. So that's where we stand in terms of our COVID census. 5 of these individuals are ICU level of care. One of them is on a ventilator. So pretty serious, seriously and critically ill individual.
Lillian, I last week there was nobody on a ventilator, right?
Right,
Okay.
correct. No one on a ventilator
Right.
last week.
And then last time we spoke, I know that you had
Where's
said,
everybody else?
Where's it? Could you just run them down? Who's in COVID care? 2, 3, 4, 5?
Sure. Let me
Thank you.
hold on a minute because I
Okay.
did send that over. Oh, God, where are my notes? Okay. In the COVID Care 2, which is our designated ICU COVID, there are 4 individuals in there. No one is on a ventilator in that Care 2 unit, but they are on supplemental oxygen, high flow, and even on CPAP oxygen supplement. In the Care 3, we opened that back up as a COVID care unit. That's our 4th floor. All pediatrics. We have 5 individuals in there. And they're basically medical condition patients who are pretty stable. In the Care 4 unit, which is our 3rd floor medical telemetry unit, there are 22 individuals in there. And then in the Care 5, which we opened up last week, that's half of the ICU on 2nd floor. I believe there are 4 in there. Hold on a minute. Let me just make sure I have my notes with me. But there were 4, is what I understand. And one of them is the individual who is on ventilator. You still with me?
Yeah, Bree's doing her math.
Okay. We also have quite a bit of individuals who are hemodialysis, who are receiving hemodialysis, and that's a concern. And I believe there's going to be a meeting with public health this afternoon or sometime this week to address, the issue of individuals who need to continue hemodialysis, but perhaps do not need to be in the hospital, and maybe they can continue their dialysis treatment in a designated facility that is for COVID individuals.
So these are individuals with COVID.
Right. These are individuals with COVID infection, but they do not necessarily need to be in the hospital.
Mm-hmm. We talked to you last week when I asked you to describe what was the condition of GMH, and at that time I believe we were at 27 or something hospitalizations over at GMH. We're at 38 now. Are we still in serious? Or are we beyond there?
Yes.
Are we beyond serious?
What was that?
Last time we talked, I think you had described how serious the situation in the hospital was, and at that point, we only had
About 27.
about 27 hospitalizations. Obviously, that's gone up by 11. How much more serious is it?
It's still very serious. It's always been very serious. And so, but we make do with what we have. We take care of these patients as they come in. We continue to juggle the rooms and the beds around. And, we shift staffing to where we need them the most. And fortunately, the non-COVID areas of surgical floor, which is up on 4th floor, non-COVID medical surgical, and also in the PEDS area, in the labor and delivery, in the OB area, our census has been at a level that is pretty manageable, that we can then shift some of that staff to help out in these other areas that we really need them to help out.
Mm-hmm. Have you, I know when we spoke with Dr. Hoa, he mentioned that talks were underway with the Guam Surgery Center to move non-COVID patients out of GMH to free up space to take on more COVID patients. Has that transpired yet?
We talked with the management of Surgery Center, but I think what was more practical and what was going to be more beneficial was the staffing. Um, they've offered about 9 of their nurses to go up to GRMC to help GRMC, so that way GRMC can have more rooms for non-COVID patients. And so I think that's what finally we all agreed, because they still need to continue. They still have some of their surgeries ongoing, and so they're keeping back some of their staff to manage those cases that they have to continue. And so, but they were able to then spare some of their nursing staff to GRMC.
So have any non-COVID patients been moved out of GMH over to GRMC now that they have
We
additional
have
staff?
been, we have been, but not in large volumes. And so, and GRMC, they accept when because they also struggle with their situation with staffing. They're seeing more and more COVID patients come into their facility. So, we're exchanging patients.
Lillian, you mentioned the PUI in the emergency room. What's the turnaround for testing for people who come in?
Well, even if they're negative with the Abbott, the doctors still want to confirm it with the PCR. So I think that's what they're also waiting for, because of the clinical symptoms. They really want to make sure that if it is Abbott negative, but the symptoms are that the individual's demonstrating, they just want to take extra precaution and get the PCR test done. And so I think that is what they're waiting for, is that PCR test result.
Does that take 24 to 72 hours though, the PCR?
Well, it depends, because when we send the specimen to the public health lab, we do give it a priority, and so
okay,
they
so-
take that into consideration. That this individual is in the hospital, and they want to prioritize that.
Lillian, you said that you had a meeting with, was it with GDOE this morning about the nurses?
Yes, we had and we've had really successful and fruitful meetings last week with DOE Superintendent John Fernandez, his leadership, Julieta Kineni, and we also had session with the nurses, a Zoom meeting to hear their concerns and their anxieties, and what. Somebody's waving at me. Is that a sign?
Oh, no. Sorry. It's involuntary muscle memory.
Okay, all right. No. So this morning we started the orientation. What started out to be a list of 17 DOE nurses, it's now down to 15 DOE nurses. And so this morning I met with them, and it's ongoing right now with the orientation and allowing them opportunities to ask questions. And so also we want to give them the opportunity to give us their preference, where they would like to help, and so that way they are successful, and that we pair them up with a mentor, with a senior nurse. And so it looks it really looks promising, and it looks like they have that interest and the desire to help us out here at the hospital. And so they're supporting us with our call, with our need.
Lillian, we also talked to you last week, and you confirmed that staff are being sidelined, whether it's because they're being tested for COVID or they have COVID. Can you give us any more information on that? We had a lady call in this morning who says that her brother is a nurse up at GMH, and that
a charge nurse.
A charge nurse, and
And his wife also.
and his wife both tested positive.
Right. We have several of our staff who have been exposed, and the results came out to be positive. So they're out on isolation. If not home, then somewhere they are isolated, and so we're not allowing them to work. And so that again challenges us with our staffing situation.
Lillian, and again, we just want to get this vetted, but we keep hearing things about non-COVID patients at GMH being exposed to COVID-19. Is there any accuracy to it? Is it happening? What can you tell us about it?
For non-COVID patients who are exposed to COVID patients, I haven't heard that one.
No,
is that what you're hearing? Non-COVID
Maybe
patients
Bree can
exposed
word
to
it better.
No, we're hearing there are non-COVID patients that are that have gone to GMH or are at GMH, then they turn positive for COVID, that they basically were infected at the Guam Memorial Hospital. Have you had any
That
situations where that
I
may have
haven't
occurred?
heard. I haven't heard that one. That they have converted to positive. But I follow up with our infection control nurse, and I'll follow up with our clinicians. But it's our staff who are getting exposed, who are converting to being positive. Non-COVID patients in the hospital, I haven't heard that.
Okay, so then you are
Um,
confirming that staff at the Guam Memorial Hospital have tested positive for COVID after being in contact with COVID patients.
Not necessarily with COVID patients. Some of the staff, or at least a majority of the staff who turned positive, were not at all exposed to COVID patients here. So we are looking and we think that they were exposed. They contracted the COVID outside of the hospital.
Okay.
So they were not infected at GMH. That's your belief.
Not to what I am informed. Majority of the ones that I've been informed are positive and are out due to outside exposure.
Right. Lillian, what can you tell us about sadly, the nurse that had passed last week to COVID, and we had heard that she had tested negative so many times and then tested positive. Are you able to discuss the nature of that at all?
It's still under investigation, and I haven't gotten the full report from our infection control nurse, and I'm waiting for that report. But at that time when the individual was in our hospital, she was getting visitors, because we still allowed visitors to come in at that time, throughout that time that she was here. So we don't know if someone who came in and was positive was probably asymptomatic and expose the patient. So
Yeah.
we're still going through the investigation. We're getting the facts, the data, and I haven't gotten the final report.
Right.
But
I'll
she-
follow up with our infection control nurse.
But she was allowed visitors because she was a non-COVID patient, right?
Correct.
Correct. Okay. And so then for the people that came in to visit her, wouldn't they have had to gone through some sort of like screening or something like that in order to get into the Guam Memorial Hospital, not have any sort of symptoms?
We do. We go through the screening, the temperature checks. We ask them some questions. But remember, there are people who are asymptomatic.
Yeah.
They're walking around asymptomatic and are just as contagious and just as infectious, but they don't know it. They're not manifesting any symptoms. They're not feeling any symptoms, or they can deny that they're having any symptoms. So even if we do ask them the questions, they can say they don't have the symptoms. But we do check their temperatures coming in. And if, again, they're asymptomatic, we allow them to come in and visit.
Yeah. And I ask you that because there may be some that may question whether or not GMH isn't doing enough to protect, people that are inside the hospital and ensure, you know what I mean? Ensuring that they're not infected with COVID.
Sure,
That's
I
right.
understand.
Right.
I mean, and we're trying to do what we can do. But, again, like I said, many people walking around asymptomatic.
Right.
So, can you give us an update on anything with tents or FEMA? Because FEMA, they provided I think $11 million to the CNMI for PPEs, money for healthcare over there. So I'm wondering if you guys have heard anything from FEMA in providing any sort of support.
They have been providing a lot of support. They've been providing a lot of the PPEs. In fact, there's a crate or a container full of N95 masks. And so we're having our infection control nurse screen it whether really it meets the criteria for it to be very effective as an N95 mask. Because there have been some masks that we received from various, international sources, but do not really meet the U.S. standard of an N95. mask. And so we're making sure that our infection control nurse reviews it and, takes a look at it, examines it to see if it does meet the criteria. So we have been getting, quite a bit of supplies from FEMA. We received, as I mentioned before, the ventilators. Um, and so we do have 50 some ventilators on hand if we need to use them. Those are available. Funding, we have received funding. We met with Brian Trang from FEMA last week regarding the alternate care facility, the SNF, that we are, designing a plan to make it an alternate care facility, not just as an overflow, but if we need to then step it up to an ICU level of care within that facility, we can do that. And so we've put together our plan. It is about 95% complete. And what Brian Trang from FEMA was able to review, he seems to be very satisfied with what we put together in that plan. So we do get, quite a bit of support and assistance through Homeland Security, through our Office of Civil Defense, through the governor's office from the federal government. In fact, we're meeting with Region 9 emergency, coordinator for the regional emergency coordinator to take a look at our request for medical personnel. As we mentioned last week, more critical care doctors, more critical care nurses, respiratory therapists. And so we're going to be meeting with the gentleman tomorrow to discuss it further and for him to complete his assessment with regards to our needs.
And any word on did I ask you about the tents?
Did she ask you about the tents, Lillian?
You did earlier, and I'm sorry, I kind of got off the track here with talking about the tents is what I understand. In fact, the surgeon cell, they've come and they are coming again this week to take a look and assess where we can set up those tents.
So we have them on island now? The Blue Med
I
tents?
don't know if they are on island.
Okay.
I haven't heard that. I might find out today at the meeting. I'll find out if we have them on island. But yes, those have been discussed previously as far as having a mobile tent for it to be an acute care facility.
Okay. SNU, the SIF. Is there any update on that?
Sure, absolutely. We finally got the portable chiller, which is again, it's just a temporary chiller, and it's already placed right outside of the SIF, right at the front, to the side, to the left side if you're facing the facility. They had to kind of delay it Saturday because of the weather, but by Saturday afternoon, they transported the temporary chiller, and it's now secured in place right outside of the facility. They've been working, the representative, the techs, I've been working throughout yesterday afternoon to, get what they call, I guess, hot works, the oil to get the chiller, I guess pumped and oiled and ready. And so they turned it on last night. And so the temperature as of this morning is at 63 degrees. We want to make sure that we monitor it and it's consistent, and that the facility is cool enough for us to occupy it with patients.
So we're looking at hopefully any time now that it'll be ready to go?
We're hoping, absolutely. We're hoping that perhaps today we can do that. We can get some patients up there.
Okay, and we do have the staff to man that facility.
That's
right.
what we're also working on to make sure we have that staff.
Okay,
Yes.
I wanted to follow up because I keep seeing this circulated in social media about the hospitalization. So how many hospital beds do we have at GMH to handle COVID patients? How many COVID designated hospital beds do we have?
Okay. In Care 1, we have 5. In Care 2, we have 4. Those are ICU level. In Care 3, we have 17. In Care 4, we have 19 single rooms, but we can double up some of those rooms so we can get 26 beds in Care 4. In Care 5, which is our ICU level, we've got 7 in there. So add that up. I haven't added it up yet, and my mental calculator is not working right now. But and then we have the 54 beds up at SIF.
And I asked that because in this letter that it keeps on circulating that the governor wrote to the CDC that we had 83 designated COVID beds. So as of today,
Well,
go ahead.
At that time, we didn't have the Care 5, which was an additional 7 ICU beds.
So we will have 83 COVID designated hospital beds. It's not necessarily that we have them right now.
Okay. Did you add up all the numbers I gave you?
Well, I'm not sure it's
5, 4, 17.
Can somebody add that up for me? 5, 4, 17, 26, 7, right? Plus if
Okay, that's 59 plus the 54. That's about 103 beds.
right, but we're not sure if the 54 will be ready today or not, right?
Right. Yes. We're pushing for it to be ready.
Okay. No, because the letter said we are also prepared for any surge in hospitalization with 83 COVID designated hospital beds with a capacity to increase beds 200 or more. Wow.
Well, we've got the MCH area also. If we do move those clients out of the MCH, we have 20 beds in the OB ward that we can then designate as COVID if we move the MCH clientele up to GRMC. And then we also have 10 beds in the pediatrics area if we move the MCH over to GRMC.
Lillian, anything in closing you want to add?
Well, I just again want to urge the people of Guam to really, take the preventive measures of putting on the mask and social distancing. And the other thing that I also want to encourage the community, if you start feeling the symptoms, don't wait for 5-6 days, especially if you're having a hard time breathing, you're having abdominal pains, and you're having some, diarrhea. You're losing fluid. You're getting dehydrated. Get medical attention, whether it's at the clinic, or at your private doctor, or at the Northern Health Clinic. Get medical attention. Don't wait till you're really acutely or critically ill, because then you end up needing to be in the hospital. You end up needing supplemental oxygen. But if you can get your treatment as soon as possible by seeing your medical, your private medical provider or a clinic, then hopefully this will increase your chance of recovering from this COVID-19 infection, and hopefully no further deaths. We will not see further anybody dying anymore.
What are you hearing, Lillian? Are you hearing that we peaked with our number of
That what?
positive? Are you hearing anything with the status of the COVID positives? Are you hearing that we may have peaked?
Well, we're going to continue to see numbers, high numbers. That's already pretty much a given. That seems to be the norm, that we're going to continue to see people converting to positive. The key now is to really try and prevent these individuals from going into acute, critical, illness status. We want to prevent them from getting to that point by catching it early and getting the treatment.
Lillian, what are people taking? Those people who have COVID and they're staying home, they're not going to the hospital. What are you hearing? Is it just Tylenol? What's working that you know of?
Tylenol, liquids, vitamin C, resting, just to get through it. If they're having vomiting and diarrhea, just, make sure they take some liquids in so that they don't get dehydrated. The headaches, Tylenol is the best choice of medication, not Motrin. Because Motrin, if you're not eating much of anything and you're taking Motrin, that can irritate your stomach. So, Tylenol is really the safest antipyretic medication for someone to take. But yes, liquids to keep hydrated, vitamin C to help fight this infection, and just eating healthy stuff and not smoke for a while. At least stop smoking for a while.
I just had one more question, Lillian. You said 59 beds currently at GMH to take in COVID patients. If we don't get the SIF open today and 38 of those 59 beds are filled, are you going to be able to take 21 more COVID patients today or even in the next couple of days?
if they come in and depending on their condition, if they don't need to be in the hospital, they can be managed at home or at the isolation facility. They don't need to be on supplemental oxygen. But, we will see them and get them evaluated by the doctor, by the clinician. And if they don't need, we do have some individuals in Care 4 that are pretty stable that can be discharged. So, again, it's a constant flow.
Yeah.
A
It
patient
just
going
seems
out,
like it's beyond
going in.
serious.
What's that?
It just seems like it's beyond serious. If there's only 21 beds available, and say all 21 are serious and need medical attention.
Yeah. I mean, this is where we're really going to need to call all our resources, what we've got, where we can put them.
Okay, Lillian.
We may need to. Okay. All righty.
Prayers to you guys.
Yeah, we got a bunch of
What's
comments. A bunch of comments coming in
Prayers.
supporting you and the staff, Lillian.
prayers.
So,
Yes,
all right.
prayers.
Okay, we'll see you.
But, okay.
Thanks for joining
Take
us,
care.
Lillian.
Thank you,
That's that. Okay.
Lillian.
9:46. Let's keep it going in the KUAM News Zoom room. Let me see. Do we?